Mozaic India extends a hearty welcome, dear all. Today, I am here to discuss on a minimally invasive heart valve replacement technique which is getting popular across the globe. We all know that our heart is a vital organ made of muscles that pumps blood to all parts of our body. It has got 4 valves that act like doors. They open and close to let blood flow from one area to another. The heart valves ensure that the blood moves at the right time and in the right direction. As the heart valves open and close, they create 2 sounds which are called heartbeat. Aortic valve is the largest of the 4 heart valves. When the valves are damaged or diseased, the heart needs their immediate repair or replacement. Valve stenosis or stiffness and leaky valve are conditions that may cause heart valve dysfunction. Traditionally, open heart surgery is used to repair or replace a heart valve. However, newer, less invasive techniques have been developed to replace or repair heart valves. These minimally invasive procedures make only smaller incisions, leaving less pain and shorter hospitalization, besides reducing post-surgery complications. Transcatheter aortic valve replacement or implantation is a minimally invasive procedure that involves replacing the aortic valve in people with aortic stenosis. Today, we have with us 3 eminent cardiologists from Central Travancore, Dr. Sajan Ahamed, Dr. Mahesh Nalinkumar, and Dr. George Koshy to discuss the procedure in detail. First of all, Dr. Sajan Ahamed will explain what is a transcatheter aortic valve replacement or implantation.
The heart is really an incredible machine, and like many machines, it requires valves to function effectively. So we have 4 valves in our heart, 2 on the right side and 2 on the left side. And aortic valve is one of the 2 valves on the left side. We know that the heart is a very hard-working organ. It pumps every day for the entire lifetime. And all the blood that the heart pumps, the ventricle pumps, has to go through a major artery called the aorta. And that is the artery which supplies blood to all the organs in our body. So the aortic valve is actually located between this aorta and the ventricle that pumps. And so the valve has to really open up and allow the blood to go from the heart into the aorta. In very elderly patients, especially due to age-related changes and also due to deposition of calcium and other materials, these valves can become thickened, stiff, and they don't open well enough. So that whenever the heart pumps, the entire blood is not able to go through this narrowed valve and reach the aorta. So this creates problems for many patients, and this leads to symptoms like breathlessness. So when somebody exerts, they feel breathless, or when they exert, they can have chest discomfort or chest pain, or they can even feel lightheaded or some kind of blurring of vision on exertion. So these are the usual symptoms which this condition produces. So this condition is actually called aortic valve stenosis. Stenosis involves narrowing. So traditionally, the treatment method that was used for this disease was that the surgeons, the cardiac surgeons, our colleagues, they used to open the chest and then excise or remove the diseased or narrowed valve and then replace the diseased valve with a new valve. These valves were of 2 types actually, conventionally. One is the metallic valves, or the made up of different alloys, and the other is tissue valve, or sometimes called bioprosthetic valve. So these were the 2 traditional methods. So just like every other field in medicine, advances have happened over the recent years, and a new technology that has come for treating this aortic valve stenosis is TAVR, that is TAVR, that is transcatheter aortic valve replacement. So through catheters, we replace the aortic valve. It's also known as TAVI in some places, where it is expanded as transcatheter aortic valve implantation. So what we do is actually go through arteries in the legs, in the groins, and take tubes, and inside these tubes we take the artificial valve and then take it to the aorta, inside the diseased valve and deploy the valve at that particular location. So here actually it is done without surgery, without a heart-lung machine, without opening up the chest of the patient, and actually without even removing the diseased valve. The new valve is put inside the deceased valve, and then the new valve takes over the function, and the patient can hopefully have an earlier recovery, and we can avoid probably the complications of surgery in some patients, especially selected patients who are very elderly and who also have other conditions that increase their risk for surgery.
Dr. Sajan, compared to the open heart surgery, does TAVR or TAVI involve lesser risk? What are the pros and cons of this newer procedure?
Risk is a term that is often discussed in the medical context. So I would say that every medical procedure will involve at least some risk. There are no procedures without risks in medicine. But of course, we always look at the risk-benefit ratio. So whether doing this procedure will benefit the patient more rather than creating risk. So what we see is that the usual, when we tell an elderly patient about a surgical option for treating aortic valve stenosis, many patients in our part of the world would say, "Doctor, I don't want surgery. Can you just give me some medicines?" So these are the usual kind of questions that patients ask. So TAVR has actually come as a boon in patients who are reluctant for surgery, or in patients who are deemed to be at very high risk for a surgical procedure. For example, there were few of our patients who were very elderly, above the age of 80 years, but they are very symptomatic. They can't even do their normal activities. At the same time, they are having other serious diseases of the other organs, like they have lung problems or kidney problems, which place them at a very high risk for an open heart procedure. So in such situations, TAVR is useful, and if done in selected patients, it really benefits the patient, and naturally it avoids surgery, so that part is fine. And then the duration of hospitalization. So unlike the traditional surgical procedures, if everything goes well, touch wood, then the duration of hospital stay is also reduced. On the other hand, every coin has got two sides. So I wouldn't say that TAVR is a very, very, riskless procedure. The risk is less, but of course there is a risk involved in any procedure, especially of this complexity. So one issue is that the aortic valve is located near the area which has control over the heart rate. So some patients during procedure or after procedure might have reduction in their heart rate, and they may require a pacemaker implantation. Another issue that we anticipate is this valve is located close to the area where the coronary arteries, or the arteries that supply blood to the heart, arise. So if there is obstruction to coronary arteries, that can create problems. But nowadays we are with imaging and technology, we are able to anticipate which all patients are likely to develop this problem, and we can often take preventive measures during the procedure. Then in addition, even though I said that it's a non-surgical procedure, we have to at least have an access through which we can take these valves to the heart. So some patients can have bleeding complications related to the groin, where we put the tubes and everything, but these are not very commonly seen. One major advantage, which I would say, is that patients who undergo replacement with metallic valves, they require the use of prolonged use of blood thinners like warfarin. For the new kind of valves that are used for TAVR, this requirement is not there, and they can be managed with antiplatelets. So patients who are at very high bleeding risk, if they take the blood thinners, are also benefited by this procedure.
Now, let's ask Dr. George Koshy on certain other technical aspects of this procedure. Dr. Koshy, is mitral valve replacement too possible with this TAVI technique?
Yes, it is. With a slight change in the technique, we have to approach the mitral valve from the right side of the heart. So it will involve going from the right side, from the veins in the legs, going to the right side of the heart. Then you're making a hole in the wall of the heart, the septum, which separates the right atrium from the left atrium. That is the small chambers of the heart. Then from the left atrium, you are accessing the mitral valve from this position. And then otherwise, the technology is almost the same, the deployment and all those things. But then the indications are slightly different. It's not so commonly anticipated to be done as you're doing in the aortic valve, because the indications are different. And mostly the indications now is for people who have already undergone surgery with bioprosthetic valves earlier. There are two types of valves which are implanted by surgery, which is using a metallic valve and secondly using a tissue valve, that is bioprosthetic valve. So in the metallic valve we cannot do this. We can only do it in patients having bioprosthetic valves, which over time has degenerated, and the opening of that mitral valve has become narrow. So you can implant the new valve over an already degenerated artificial valve, the bioprosthetic valve.
Dr. Koshy, can we expect more simplified invasive techniques in treating cardiac problems, avoiding high-risk open heart surgeries in the near future?
So many surgeries were done for pediatric patients, children born with defects like holes in the heart at various levels. Now you can use tubes by the same technique, approaching through the veins or the arteries of the legs, and you can close the defects without resorting to opening up the chest like conventional surgery. Again, here the recovery time is shorter. There is no need for any cardiopulmonary bypass, and it's only anesthesia which is required. And you see, like in coronary artery blocks, which is a conventional term, people say block, and that results in heart attacks. That's regarding the arteries which supply the pure blood to the muscles of the heart. So earlier, when patients had many blocks, they used to be sent to the surgeon who would do bypass grafting for all these blocks. But now you have evolving technologies whereby you can even address your totally blocked arteries by using newer techniques. And if there was a lot of calcium in the vessel, that earlier on would not be a candidate for angioplasty. But here also again you have techniques like rotablation and so on to deal with calcification in the arteries. You can still give an option of doing angioplasty for many blocks rather than sending patients for surgery.
It's a fact that TAVI is becoming popular in Kerala too. Let's hear what Dr. Mahesh Nalinkumar has to say on it.
Yes, as expected, in Kerala also, TAVR is becoming a very popular and a very commonly done procedure. But then you have to understand that any hospital with a cath lab cannot do a TAVR procedure. You have to have a cardiac surgery team as full backup. You have to have a nephrologist, a neurologist, a cardiac anesthetist. All the paraphernalia required to support you in case something goes wrong should be in place before you start a TAVR. And it's ideally done in centers which does more than a specific number of cases a year, so that the hands-on experience and the expertise is maintained.
However, the cost involved in the new procedure is much higher than that of an open heart surgery. The cost of TAVI in Kerala is said to be approximately 15 lakh rupees, whereas the open heart surgery for valve replacement costs only around 4 lakh rupees. Can we expect a reduction in its cost factor too in the near future, Dr. Mahesh Nalinkumar?
Coming to the cost of the procedure, to begin with, it was more than 25 lakhs. Now, as the period of time changes and as more and more the numbers go up, there's obviously that common economic sense says that as the numbers go up, the cost is bound to come down. So from 25 lakhs, it has come down to as low as 15 lakhs now, probably as a period of time when more brands of the valves come into picture and more people get used to it and more numbers of valves get implanted, there is definitely a possibility that the cost is going to come down. It's a very, very optimistic future.
Heart healthy living involves understanding our risk, making healthy choices, and taking steps to reduce our chances of getting heart diseases. We can lower our risk of developing heart disease that could lead to a heart attack by taking appropriate preventive measures. That's all this time, dear all. Hope you enjoyed the video. Kindly put your suggestions and comments in the YouTube comment box of Mozaic India. Thank you.
Magniloquent, optimistic, zestful, awesome, inspirational and courageous. Let's explore together.
നേരിന്റെ നേർക്കാഴ്ചയായി Mozaic India, a mirror to memorable musings.